Well, today on Wellness with Wood, Corewell Health is celebrating its 20th anniversary of the Fred and Lena Meijer Heart Center. It opened up to patients in 2004 and helped start the Medical Mile on Michigan Street. And here now to discuss the remarkable work that's been done over the last 20 years for the community, Nancy Schwalier, Vice President of Cardiovascular Health at Corewell Health in West Michigan. Nancy, thanks for joining us.
Thanks so much for having me.
A lot has happened in 20 years. Tell us about the beginning of the Cardiovascular Center.
Yeah, it's very exciting. You know, Fred and Lena Meijer Heart Center, Fred and Lena Meijer, along with 3,000 other donors, gave $35 million to start the Heart Center.
Yeah.
But Fred said at the time that it was more than the brick and mortar. It was a place to house the clinical programs and the people that strive for clinical excellence, medical education, and research.
I mean, it's a matter of so many people at the time. I remember, it was a very exciting time on Michigan, to see all of the developments that were just starting. That really was the catalyst, I think, for the Medical Mile, don't you?
It really was.
Yeah.
Yeah, the Heart Center was the first of what was to become $1 billion worth of health architecture that we now call the Medical Mile. It was joined a few years later in 2008 by the Lemon Holton Cancer Pavilion, and then in 2011 by Helen DeVos Children's Hospital to form what we now call the Medical Mile.
Yeah. So what kind of programs does the center hold?
We have a wide range of programs, starting with prevention all the way up through transplant. In 2008, I think, 2010, I had to bring my notes, we did our first heart transplant. We've done over 250 since then. A few years later, we did our first lung transplant. We've done almost 400 of those. Alongside that, we've done our heart assist device, which is a pump that's inserted to help failing hearts live a little longer, if you will. It gives people back quality of life and gives them some time. We use it either as a bridge to transplant or destination therapy even for some patients. We're the state leader in our transcatheter aortic valve replacement program and one of the top volume centers for coronary artery bypass grafting.
A lot of this, I would imagine, requires education for people, too, to know what's available to them.
For sure, yeah. People often underestimate what we offer. But really, for what you had to travel for 30 or 40 years ago, you can have done right here in Grand Rapids now.
Tell us a little bit more about the innovations that you're working on.
Around 2010, I think, Fred and Lena gave us another gift, and we created the Frederick Meijer Heart and Vascular Institute. That allows all of our subspecialists to be in one area and offers a collaborative approach to the way we deliver heart and vascular care. A great example of that is our heart team. That's where all our subspecialists come together once a week. They discuss the most complex of our patients and collaboratively decide what the best treatment plan is for those patients. It's like getting a second, third, or even fourth opinion right there in that meeting without the patients having to do anything.
Yeah, so much is changing, so much is being added, improved, expanded on. I would imagine people can learn a lot more about what the Fred and Lena Meijer Cardiovascular Center offers online. Am I right?
Oh, for sure.
Yeah.
Yes, both from our website and our Find a Doc portal. You can get to us that way. You can learn more about us.
Well, congratulations on 20 years.
Thank you so much.
What changes we've seen over that time.
Yes.
Okay, Nancy, thanks so much for joining us.
Thanks for having me.